All right, so you guys know Juana. She's here thankfully to share with us a little bit about advocacy. And I'm super excited to hear what she has to say.
Hi everyone. Hopefully your day is going well and you guys are almost to the finish line. So, um, uh, I'm gonna go over advocacy in healthcare, but also what you can do. I think a lot of times we put ourselves in a little box. Well, that, oh, what can I do? Like, oh, I'm just little old me. Just a student, or I'm just an LPN. I'm just an RN. I'm not, the people that they pay big money for to make these decisions. But in reality, it begins with the person at the very bottom saying there's something wrong. I don't like this. I wish this was like this. I think that this would be a better idea. And it begins with those kinds of thought processes, because I will show you a personal example of how me and other nurses were thinking along the same lines of healthcare, how we didn't find certain things were fair, or how we felt we were in silos within our working environments. Right now, you guys have this community that you are a part of. It's a student community. You guys get to see each other. And I'm sure that you have different, maybe, dynamics. Some of you work, some of you, work while you're going to school, some of you don't. But when you disperse into the real world, you guys will be in different areas, and sometimes it'll feel lonely, and you will, some of you will work together and most of you won't. So knowing what you could do when you get there. Clicker, gotta use the clicker.
Oh, you might have to click back on the screen.
Okay. Here we go. So definition, I guess I'm going to let you guys know in advance. I have this cool cute little kitty. His name is Sammy. His name's on the little thing. And if I throw this at you, it means A, catch it. I don't want to hit you in the face. And B, it means it's your turn to talk. So I might be handing this off to you if you raise your hand, or if I'm just saying we need engagement here and you guys aren't communicating with me. So you're going to be forcefully engaged upon. Okay. So somebody read this for me?
Issues are problems, injustices, or subjects.
You forgot.
Sorry. I'm not good at that. Definition. Issues are problems, injustices are subjects of personal or public concern to which people adopt conflicting attitudes. These are things that can directly or indirectly affect members of a society in a negative way.
Perfect. So from what you guys read, can somebody give an example of what an injustice might be, or a personal or public concern that you guys could use? And louder, sorry, I have bad hearing. The military did that. So being biased, yes. So being biased, and also being a part of somebody's being biased towards you, correct? And that shows up. I'm glad you brought that up. That's one of the things that I'm going to talk about, that I feel deeply and passionate about, is that happens a lot in healthcare. And we would like to believe that healthcare is here to help all and, take care of all. But unfortunately, that is not always the case. So having that awareness and understanding the system will help you greatly in navigating those injustices that still occur, whether people like to acknowledge it or not. Okay. We're going to practice our throwing, I guess. Thank you. This came, thankfully, I didn't have to make this, but this came with a little slideshow of different types of advocacy. From the image, you can make kind of delineations on what types of things without words. For example, the world emoji. What can that mean in regards to advocacy? Somebody give me an example. I hear a lot of whispering. I'm going to let you guys know I have really bad hearing. The military messed those ears up. So if you're going to say something, I'm going to need you to be very loud, and you're going to have to talk towards me so I can hear you. I want to make sure that whatever you're saying, I can hear and I acknowledge. And so I can also repeat it to everybody else. So if somebody whispered something, I didn't hear it. Mhm.
Sometimes they conflict between me and maybe with the co-worker, with the creator. That is what I'm taking from there.
From the world. That is, so being from different cultures and different parts of the world. Is that from my understanding?
Yeah.
What part of India? Okay, I was in Calcutta for a month. Foreigners.
Father, language is different, culture is different over here, we have 30 states. And every single state, they have different culture, different language, different foods, and different classes. Yeah, like they have 28 languages.
28?
Yeah.
That's a lot. That's amazing. I did enjoy my time there, but it was a while ago. I think it was in 2017. But I only got to experience that one part of culture of India, not, the entire, but it would have been great too. Yes, so that's an example of world. Is there, for that one, I'm just gonna focus on the world. What other examples? Because we can, she just explained about different cultures and different, being from different countries, like, so any other example?
Affordable healthcare.
Affordable healthcare for the dollars. I mean, it's right there, money signs right there. So that's 2 for 1. So affordable healthcare for the dollars. So yes, healthcare is not affordable. I will share this with you. I did not have a personal medical emergency, but my grandfather had a medical emergency in Mexico a week ago. So I had to go tend to that. I am the only medical person in my family. So I had to go do what I could. And thankfully, whatever I did worked. So he's fine. But we have to pay out of pocket for good care in Mexico. It's not free. So it was upwards of $40-something thousand. So and that's in a country where things are more affordable. I can only imagine if I had to pay out of pocket here, I would be in the $200,000 range for the minimum for the care he received, because he was in an ICU and he got cardiovascular surgery and things like that. So $40,000 is reasonably affordable compared to what it would be in US dollars, because I wouldn't be able to afford it at all. So another example, because I'm going to help you guys think outside the box, is the world is like environmental factors. That's advocacy. Like the environment you live in, the outside, we live in Tacoma. It is clean. The air is cleaner compared to most other, states in the United States where, you land in a cloud of smog. I'm from Los Angeles, and the first thing I see when I'm flying over is a cloud of smog. The environment you live in is a healthcare factor. It has where you live, it has a great impact on how many years you will live. It has a great impact on your education. It has a great impact on your overall state of being regarding healthcare. We know that people that live in disadvantaged, lower social economic neighborhoods, even if it's in the same part of, let's say, Tacoma, there's different neighborhoods that have less advantages. We know that their healthcare outcomes are a lot worse than those who live in like nicer parts of Tacoma, like North Tacoma, because they have access to healthcare, they have access to food nearby, healthy food and so forth. So this is different examples of pictures and how that could be examples of advocacy. So I'm going to need somebody to read one, and I'm going to pick in the red hoodie. Sorry, your name? Julius. Sorry, I don't know your name. So when I throw it to you, also say your name. Yes.
Communicating healthcare systems, communicating with the team, connecting patients with the resources.
Perfect. So these are examples of patient advocacy and what that entails as your role is LPNs. A lot of your patients don't know how to navigate healthcare systems. I've been a healthcare worker for a while, and I don't even know how to navigate healthcare sometimes for my own care. So imagine somebody who may not speak the same language, who has never needed healthcare within the United States, like they've never had an emergency, they've never had to be in an ER, and finding out all the things that come along with that. So that is our role in regards to patient advocacy. Communicating with the team. There is different cultures. We all are from different cultures, and there's cultures that are not as forward in saying that they need something or that they're lacking something. They are maybe, they're not necessarily embarrassed, but it's not within them to say, hey, you know, I have this issue. I don't know how to get to, you're going to let me discharge from here, but I don't know how to get to my appointment. I don't have. So it's our role to be approachable and to be understanding that people have different needs and different communication styles, and being honest and having these honest communications with our patients saying, hey, you know, I know you're going to be discharging. You're going to have to go to your appointments. Is there something, you know, stopping you, or is there any barriers that you may face getting there? And depending on the rapport that you've built with these patients, you may be honest with you, like, well, yeah, actually, you know, our car broke down and I won't be able to get there. So for the time being, I have the appointment. I just don't know how to get there. So then being able to communicate with our social workers, with the like if there's any way that the social worker can feel like, hey, we can move this appointment out, we can get them a bus pass, we can get them a paid transportation, you know, get them a taxi or something along those lines while they figure out their transportation issues. Simple things like that are what we can do on a day-to-day basis in our job. So sometimes we can do it multiple times with, or we're going to have more than one patient, that's for sure. So if you have multiple patients, you can do that for all of your patients. And connecting patients with resources. I put that on there is as our role is really to take care of the patient. Sometimes we have the ability to connect them within resources within the hospital. But if they need something further, we will lean on our experts, which is the social worker who has a bigger, I want to say, resource available. Like they have a understanding ins and outs of how everything works, what the qualifications are, how to get it versus our basic understanding. So sometimes it is very important to lean on our experts that do this for a living. So somebody else is going to read environmental social number 2, and I'm going to say your name.
Kelly,
Kelly.
environmental social advocacy, laws and policies to help make communities better, human rights, social justice, and sustainable practices within healthcare.
Okay, perfect. So an example of that, can you guys give me an example of a policy or a law? It doesn't have to be recent, but a policy or a law that you know that has helped healthcare or communities be better in general.
HIPAA,
Yep, there you go, HIPAA. So that helped all of us. So that is an easy one. Thank you. That's an easy one because before that existed, I wonder what would happen to our information if everybody had free access, or if there was no really repercussions to people accessing your information. So that's a good one. Another example? Huh?
The Good Samaritan Act law protects people if they were to help anyone.
Great. Can you go into further detail of how it helps people?
Just if you're a nurse or have the skills to help and you were to see something out in the wild and you're not at work, if you were to help and if the patient wasn't to make it, you would all for that. And if you did help and it worked out, then that's a good thing to help.
And if that wasn't there, wouldn't everybody like have this kind of like, well, I'd be afraid to help. I'd be afraid to help anyone because you never know. This is the US. Anybody can sue anybody for anything. And I'd be like, well, I'd be afraid to get sued. But that helped people feel more comfortable in being able to handle, you know, it might be a situation where you may not be able to do much, but at least you're trying. Before people probably didn't want to try because of the legal ramifications of potentially being sued. So in regards to sustainable practices, let's use that one, sustainable practices within healthcare. What would you consider a sustainable practice that would be considered an environmental or social advocacy that you have seen? Either as your time as a student, maybe working in the medical field or anything. You're looking at me, so I wanna. Don't be afraid. It's a fuzzy ball.
Okay, I would say giving healthcare to anybody and everybody that, comes to the hospital. That's a practice that's been, on, like, not letting people go. When you come, they would attend to you, whether you have the money or not.
Yes. So that actually falls under several categories because that is a law, like it is mandated that ERs treat you. If it is an emergency, they have to treat you whether you have money or not. They can't say, well, sorry, you don't have insurance or you don't have the funds. Goodbye, which they can in Mexico, but not here. And it's also a social justice issue. That's a human rights, like we're all entitled to healthcare. Hopefully we don't have to wait for it to be an emergency to show up in an emergency. But it's a human right issue. It's a social justice issue where everybody has the ability, if they need be, to be able to access healthcare. Sustainable practices within healthcare. I'm still trying to think of anything that would kind of fall under that. If you guys come up with any ideas, I had some and they left, so I'm sure I'll get some back, but if you guys have any ideas, we'll come back to that. And then somebody can read number 3. And I'm gonna pick.
Advocacy in the workplace, community advocacy, and student advocacy.
Okay. You guys gotta work on your throws. You guys aren't throwing us strong enough. Third time's a charm. So student advocacy, what do you have in place right now in your group that you would consider student advocacy? Somebody said something over here. Representatives, exactly. So raise your hand if you're a representative. Are they here or at the luncheon? Okay, we got one right here. How many do you guys have? I'm not sure. 3. Okay. So, do you guys think based on your current use of that, does that work for you? Okay, great. Do you feel that it represents you and it speaks on your best interests, as a class to be able to have these people to speak on your behalf? That's advocacy. And, I don't know, were you voted upon or did you volunteer?
Voted.
Okay, great. So you voted for these representatives and they're doing their due diligence by representing you in regards to advocating for what you need as students and for advocating on things that may get better or things that you have recommendations on. And it's working great. That's a perfect example of student advocacy. Advocacy in the workplace. Does anybody have an example of when they spoke up in the workplace because something was unfair, something was illegal, something you did not like, and you just felt like you needed to say something and hopefully the outcome was good? You guys I'm sure you guys, most of you worked before you joined this program. I'm going to doesn't have to be in healthcare, just work overall. I'm going to go ahead.
When you're okay when you're working in a facility in a long-term care, and every time as a CNA you are assigned on the heavy patients all the time, it's not divided equally. So therefore you end up talking to the supervisor about it.
Okay. And if that happened to you, because I'm sure it's happened to many of us, including myself, were you able to speak about it and did something get done about it?
Yes.
Okay, and it was a fair outcome.
Yes.
That's good.
But I didn't mention it.
Okay. See, there's oh, you're good. You actually were well. I didn't catch it. There is times where we will speak up in circumstances like that, and we will not get the outcome we desire. Sometimes there will be what is it called? Not reprimand, but you guys are gonna have to help me with the word. Retaliation. There you go. Retaliation. Like you spoke up in regards to an injustice you're getting a heavy patient load and you notice that your coworkers don't get the same amount of load, and that it hasn't happened once and it hasn't twice, but it happens several times and there is no real rhyme or reason. And so you speak out about it, and then all of a sudden you have retaliation, like you're still getting the patient load. Now people are talking about you. They're giving you write-ups and things like that that weren't happening before. And that's illegal. First of all, that's illegal. But I'm not saying it's not going to happen. It's happened to me plenty of times where things are illegal and people still have the ability to do it towards you. That doesn't mean you don't have the right to advocate for yourself. That's where self-advocacy comes in. So that's not only workplace advocacy, that's also self-advocacy. Speaking for yourself, saying this isn't fair, I do not like this, and is there any way that we can change this? That's a good example of both. An example of self-advocacy apart from in the workplace is that we always, as nurse professionals, take care of others. We take care of our patients, we take care of our families. We take care of all these other needs besides our own. And sometimes we forget to advocate for our own needs in the work setting. Like, hey, a lot of the times you'll be given a schedule and you ask for days off and they're like, well, it's been denied. Your time off has been denied. Sorry, somebody else in the totem pole has more prior seniority over you, so you're not going. And I want to say it's a 50-50 toss-up. Some people take that for an answer, and some people like, no, that's not going to work for me. I've been working. I have these days off, and I need to take this time off. I am on the advocate for yourself as much as you can. I'm not very popular when it comes to that. I butt head with a lot of people because I don't take what I'm given. So if somebody tells me no, I ask why. And if the why is because we've always done it that way or because I said so, that doesn't jive with me either. So if nobody has a valid explanation as to why I won't get time off or why I won't get a raise, because these are things about self-advocacy. I'm going to give you a fact for all the women in the room. Women, specifically women of color, are the lowest paid compared to any other demographic, like white male being the highest paid for the same role. So we can all have the same role, the same education, but when it comes to a woman of color, she's going to be paid less than all of the other counterparts. So I am a firm believer that self-advocacy means asking for what you're worth. If you have certain education, you're not going to take, if the minimum, let's say the job posting, because a lot of places do this, they say the minimum starting rate is $30 an hour, and they put 30 to 50, and they're like, well, we're going to start you off at 30. And you think that you have to accept that because that's in the job description. Well, you come with 5 years of experience, so I'm sorry. Thank you for considering. Thank you for your time. Unfortunately, that's not going to work for me. I would like this. And I'm going to be completely honest with you. I have negotiated several salaries that even weren't negotiable. They were like, I'm sorry, we don't negotiate salaries. And I'm sorry. Then I don't think at this time we're going to come to an agreement. Maybe further down the line, we could reconsider. And then all of a sudden they come back and they're like, well, I guess we can. So it doesn't hurt to ask. That's one of the classes. That's one of the things I learned in my master's program. It was a class specifically dealing with negotiations. And what I learned is the worst that anybody can say is no. It doesn't hurt until you try. And if somebody says no, unfortunately, that's not going to work for us, and they stick to it, then you guys are on the same page and the answer is no. But you're not going to get fired. You're not going to do it. It's just the answer is no. And once I realized that the worst thing that anybody could tell me was no, I haven't not negotiated my salary anywhere, even if they say it's non-negotiable since then. So I'm just giving you guys all of that starting point in healthcare because you guys will be LPNs and they'll give you, this is what we start off with. And it doesn't hurt to ask for more because at the very beginning, the people that end up making, and this is through a lifespan of working. So let's say you start at, 20 years and then you work until you're 65, the retirement age. If you start early in your negotiating process, you make up about $1 million to $2 million difference as you progress in your education and things like that within nursing. So $1 million is a lot of money to leave on the table. Does that make sense? Don't tell them I told you though. Just don't tell them I told you, because I don't want people like, well, I heard that Bates, you know, their director's telling them. No, just just know that you have that information in the back of the in your pocket. They need you more than you need them. There's plenty of healthcare jobs out there. Right now, I'm not so sure. There's still plenty of healthcare jobs out there, obviously, but they always need you more than you need them. Just remember that. And it comes to not only pay, but the way they treat you and equitable distribution of work. So I think we all understand that it could be personal, local, national, or global. What is an example of any global issue right now that affects a lot of people around the globe, like the same issue that affects people all around the globe? And I'm going to pick. Oh, no, it was her, but so I'm glad you got it. COVID, that's a perfect example. So that, I mean, thankfully, the worst is behind us. Hopefully we don't have it happen like we did before, but that was a global issue and we were all suffering. All countries, regardless of the amount of resources they had, were backlogged on immunization supplies. I was a nurse and I had never heard of recycling your mask. I had to recycle my N95 and put it in a little paper bag. And so they would make us put it in a paper bag and then come back to it the next day. And I was like, so that's an example of a global one that was, you know, that we still. Almost. So that was a couple years ago. What's one that's happening now though? What is an example that's happening now? The economy. That is I mean, talked to people a week ago and they thought maybe a little bit over a week ago, a lot of people lost a lot of money in their retirement funds and they thought they weren't going to be doing so hot. So yes, the economy fluctuates in countries. But things that I'm thinking about, another example is the US has a lot of money and resources. So we have withdrawn a lot of money and resources from other countries in regards to the benefits we provide to other countries, like vaccines. We've withdrawn vaccines from other countries that help prevent spreads of diseases, and we don't even have to look as far as other countries and the effects that it's had with them. We can look locally and see there's been what kind of outbreaks has there been recently within the last couple of weeks? Measles. I heard of measles being an issue a long time ago, but in my mind, it was nothing that I would have to worry about in this day and age, let alone in my current, situation. But now it's something that we have to worry about. I look at when I was traveling to Mexico, there was a thing in the Seattle Times saying if you were in the airport from this time to that time, there was a measles outbreak and you need to go get tested or things like that. There was somebody, so things like that weren't an issue before, weren't issue last year. So, but now they're an issue. So that's an example of how things can go from local to global. So I'm gonna click on this and actually, no, I'm not gonna click on it. You have to click on it. If you could go to this website, let's see. If you could go to this website and enter this in, that would be great. I'm gonna go there too. Oh. Let me bring it back up. Probably help if I have it up. There you go. Type that into your phone or to your computer. Okay. I'm not going to fill it in, but this is what you guys should be seeing once you are on that. Does everybody see that? Do you need me to go back to the little area? You guys have that up? Okay, so the first question is, who do you consider an advocate? So sometimes people go off and think of like, oh, Gandhi or, like these big people in history that have created, positive outcomes, but it doesn't have to be somebody as big as that. An advocate could be your mom. Like if your mom ever stood up for you in the educational setting, an advocate could be your boss. If they stood up for you in the work setting and said, my nurses aren't going to have this many patients and we're going to fight administration who wants you to have, a 6-to-1 ratio when in reality it should be 4-to-5. That's an advocate. Like you guys don't have to go as far as that. If a student has stood up for you or anything like that, I want you to type basically anybody who you would consider an advocate. You don't have to use their name, but maybe like a neighbor, a student, or stuff like that. I'm glad you guys think your moms are advocates. That's nice. Yep, keep it coming. I want to see at least, how many is there of you guys in here? So I want at least 15 in there. So perfect. Thank you. Well, I'm glad some of you consider yourself your own advocates. That's very important. It should start with you. Because if you guys can't advocate for yourself, it becomes hard to let other people know what you need if you can't, voice that for yourself. Can an instructor, teachers, good. So can somebody give me, it doesn't have to be the person who, I'm gonna take one too, guys. It doesn't have to be the person who wrote it, but does somebody have an example of when an instructor or a teacher advocated for you guys as students? Bueller. Nobody got that reference? You guys don't have an example of when a teacher advocated for you? Huh?
About teams. It used to be 8 hours and yeah, but now.
So, I mean, that seems like an improvement to me. If I had to go from 8 hours of sim to 6, I would consider that advocacy. And did that instructor specifically say, hey, this is too much for the students, this is what I'm gonna do, and they went out to change that? Great. And was that because obviously I've only been here a couple, like maybe a month and a half. Is that recent or is that, or did that happen maybe like a year ago?
Recent.
Great. And did people like that change?
Yeah.
It's, I love it. There you go. So there you go. So, let's see here, sister, social worker, a senator. That's a perfect example. How many, raise of hands, how many people have contacted your local officials that represent you within government, whether it's a senator, whether it's your city representative? Has anybody reached out to them, whether it's by email, letter, or talk to them personally about issues that you've had that you would like to be considered? We have a professor who raised her hand. Anybody else? Okay, well, that's something you guys can do. You can reach out to representatives. Yep, go ahead here. Hold on.
I know someone who reached out to the state senator about a car insurance problem that she had. She got in an accident and the insurance company was taking forever to get her new car and all that, and she was pregnant, so she did the letter and she got this from right away.
Was the response, so I'm glad she got a response right away. Almost. But did the response, did it lead to something like, was she able to get a resolution with that response?
Yes, so it made the insurance company get back to them within a few days, like what she needed.
Now I know if I get into an accident, who to call. Okay, the next question. Oh. My daughters are advocates, but it's because they have a mom who taught them how to speak for themselves. You've used this before, Rebecca. How do I get to the next question? Next question. It says, next question. Okay, view the results. Here we go. And then this one, this is the one. You guys don't have to fill this out because obviously I need to practice on how to use this, but what do you consider advocacy work within your realm? So we're talking about local, like what you can see, what you can do within your realm. I think your name, Rachel, I'm going to throw this to you. Correct. That is advocacy right there. Providing care to somebody else who cannot provide care for themselves is advocacy work within your realm. Another example up here. Great. You guys learn how to throw and I gotta learn how to catch. So okay, so those are examples. I'm gonna move on to the next one. Here and then what does that look like for me? So I told you I was going to show you an example of what I do in regards to advocacy. When I graduated nursing school, I went to work on my nursing roles. I'm a pediatric nurse. And the demographics of nursing do not represent currently the realistic factors. They do not represent the community that you work for. So 20% of people are of color in nursing. So obviously there is more than 20% of people of color within the greater spaces of where you live. So there's a lot of things that happen that I consider microaggressions, like people telling me like, oh, people coming up to me and telling me, oh, like, there's trash in my room. Can you go pick it up? Like, I'm the nurse. Oh, really? You don't look like a nurse. So I have been told that I look like the cleaning help. I've been told by patients who I'm providing care for, very good care, mind you, that I need to go back to the country where I came from. I was born in California, so I don't know where they wanted me to go exactly. But things like that where microaggressions are evident, and I'm not gonna sugarcoat it and tell you that you're gonna have great experiences in healthcare. I'm gonna be very honest and tell you that sometimes healthcare, the people within healthcare can be very, very negative, and but you don't have to take it. That's the one thing I do have to tell you, you don't have to take it. An example of creating something that would help me is me and my friends were sitting in a car. This is how it started. It doesn't have to be anything fancy. We were sitting in a car and we're like, man, we have all these issues and it sounds like they're the same issues, experiencing microaggressions, experiencing like heavy workloads, experiencing not the level of pay we would expect for our education. And I'm like, wow, I wish we had somewhere to talk about this so we could see what everybody else was doing, because maybe I haven't solved how to get decreased workload, but maybe I have solved of how to get paid more, which I had at that time. I'm like, so I wish we could share resources so we can work smarter, not harder. And that's where we're like, it would be really great if we could create a group that has all like, that shares the same kind of struggles we do. Go ahead.
I have a question.
Mhm.
Recently, I was doing my clinical rotation at the camp.
Yeah.
And a patient said, I would prefer having nurses of my own color. And me not going there again, okay, it's a thing because she doesn't want people of my color in her.
Mhm.
But I feel like the hospital accommodating that. Because I feel like in a hospital, it should be like, this is what we have and these are the nurses to take care of you. So how you make a choice, you wanna be treated or you wanna go to a different hospital. I feel like that one is a bit fair, like the hospital saying these are the nurses who are here, instead of, oh, Jasmine can't work here because she doesn't want Scholastica go work on the other side. I feel like they're encouraging such behavior.
And I would agree with you. There is benefits, there is cons, and obviously the entire, the situation is a horrible situation to be in. I've been in those situations where, they assume I don't speak English. So, they're like, I want somebody that speaks my language, or, I'm also a SANE nurse, so I provide sexual assault nurse examination. So for anybody that doesn't know, it's when people get raped or strangled, and they go to the emergency room, I provide emergency services to them, whether that is, obviously I provide that emotional comfort, somebody they could talk to, and any resources that we could provide from that, but also we provide like emergency contraception and, antibiotics prophylaxis for STDs that they may or may not, acquire due to the sexual assault. And I come to help this person. My job is an hour away from where I live, so I just go if I'm get called in. And I drive an hour and I get there and the person says, I don't want you to help me. I want somebody else to help me. And the nurse, because there was two of us, we both showed up. She's like, well, you do realize she was white presenting, so she had light skin, she had colored eyes, so the patient assumed that she was white. She was also actually Hispanic. She's like, you do realize that I'm also Hispanic and that she can provide you the same, if not better care than I can. She's like, nope, I want you to treat me because we had different skin tones, even though we were both Hispanic. So I've been in that situation and it's a horrible feeling to know that people have the ability to say those things and think that they have they think they're in the right. But personally, if somebody doesn't want my care, and I know that I provide good care, I'm not gonna break my back to provide that care, if that makes sense. So that's the con I would find in it. The only thing is like, this person doesn't want the good care that I provide, then I'm gonna go give it to somebody else who does. Somebody who will appreciate it, somebody who will, listen to the recommendations I have to provide, somebody that will not give me a horrible treatment when I walk in the room, because let's say that you were forced to stay in that room because you tell the patient, this is what we have, and you will get care by, your name again? You will get care by Scholastica, whether you like it or not. Well, imagine walking into the room and being treated horribly every time you walk in. Somebody saying negative comments, racial remarks, being downright derogatory and rude. Like, would you like to receive that every time? So those are the flips of the coin. You can force somebody to take the care and they will treat you horribly, because I doubt that their personal stance will change just because they're being forced to accept the care. Or you can go somewhere where you're well received and that somebody would appreciate your care. I'd rather go with somebody who's gonna appreciate my care. And if that means that I went from 5 to 4 patients, by all means, that's great for me. So I never have any issue. If somebody wants to, if they want to be like, I'm not getting treated by you and that makes it better for me, perfectly fine. Let me go talk to my supervisor. Let me get you who you need. And I don't argue with them, because my mom always says, let there be two crazies, let there be one crazy and not two. If you argue with somebody, that's two people arguing that, you know, you're just stooped down to their level, and it's not going to make your day any better. But if you're just like, sure, let me get that, let me get somebody who can help you with that, then good riddance. So does that help? Yeah. Okay, great. So the thing that I was saying is that we were in the car and we just decided we wanted to do something that would help each other. So my friend had a friend at the WC, and his name is Fuzi. He is the Director of Diversity, Equity and Inclusion for the Washington Center of Nursing. And from there, we, like a week later, we were creating an organization. It's called the Washington Center Nurses of Color Coalition. I put a little flyer. I made this little flyer. So I put it up there. But now we have a group of people, people of color, that we share, like, hey, this is happening to me in my work area. This is happening to me in academia, where the students are, anything that we come across, we feel comfortable sharing with each other, because we all have the same belief systems. We want to increase diversity within nursing. We believe that nursing and healthcare should be equitable to all. And we have this safe space. So if you guys want to join, that you guys can let me know, or let your instructor know. I could take a list down and I can give it to Fuzi, who is the organizer of our monthly meetings where we drop in. You don't have to be a nurse yet. If you want, if you have questions as a student, you can pop in. We meet like once a month in this, and then we do have a conference coming up May 16th, next month, in regards to these kinds of topics. And what I'm saying is, it all began with a conversation in a car, and now we're statewide in regards to growing our members and having people reach out. And we have a lot of smart people in this group. Like, so if I don't know the solution, and if the person next to me doesn't know the solution, there is somebody who has experienced what we have experienced. There's somebody that has done something about it. So we don't have to think about it and rack our brains. We can just go, hey, this person tried that. Let me go try that where I work. And we get such amazing results that we don't feel like we're in silos. We feel supported. So that's just a way of an example of like how you can make a difference. If you see there's something missing, like I didn't wait to see if somebody would come save me. I kind of just like, what can I do? And that reached into a statewide organization. And now we create conferences. So that's an example. I'm a mentor. So this group also, WC, not this group, but WCN, Washington Center for Nursing, has a mentor-mentee group. Last year I was a mentee. Somebody took their time, they volunteered to help me develop my leadership skills, like things that I was lacking in, and things like that. And because of that, I am now a director of nursing. You know, I don't think I would have been a director of nursing if I wouldn't have had the guidance. He happened to be a director of nursing as well. So kind of put that little, what is it? Thing in my ear where like, oh, I wonder what I could do with that. And I wonder how that would work and look for me. And here I am today. So now I'm a mentor. I will be receiving somebody within nursing that may not be a director of nursing, but just wants to know about leadership within healthcare. Those are things that I can control. I speak out often. I have a saying, I'm not going to be popular sometimes because of the things I say, but I'm not here to be popular. I'm here to, do what is right for the students, for myself, for my faculty. And if that's not a popular decision, then I'm okay with that. Because sometimes popular decisions aren't the best for everyone. I ask for help. I have great faculty with the area that I work in. If I don't know everything because I've only been here 45 days, but sure lean on them. I ask for help with anything that I'm not sure about. I'd rather ask than get it wrong. And then asking the experts. There are so many things that I don't know as a pediatric nurse. There are so many things that I don't know as a SANE nurse. There are so many things that I don't know as a director of nursing, but there are people around me who do. And I lean on them because that's how you do. You got to build your network. You build people that, okay, like, hey, if I ever have a question, is it okay if I reach out to you? And the general answer, most people want to be helpful. You may not get the answer when you want. Like if you have an emergency and that person doesn't get back to you, they're probably busy too. But most people are willing to help if you ask them and say, hey, I have this problem. What do you suggest, or what are avenues I can deal with this? And things like that. And then this is just something for you to guys think about. I really think that you can focus on what you can do now, like today. If you didn't eat breakfast, you can advocate, hi, professor, I need to go get myself a snack. I didn't get to eat this morning and I'm not thinking correctly. I'll be back. Like advocating things you can do now. Once you tomorrow, what can you do for yourself tomorrow? Once you graduate, 1 year from now and 10 years from now, you can have these things in the back of your mind and set a plan. So hopefully you get done what you want to see done. My goal in nursing that, this plan is a part of a 10-year plan where I specifically joined nursing because I wanted to see people like myself within nursing. I wanted to see people that spoke my language. I wanted people to be able to feel comfortable, not being afraid of legal repercussions, like accessing healthcare with right now with the migration things and things like that. That's why I joined nursing. And I'm doing my best. I figure that the best way I can do that is working in academia where I can develop this generation's nurses and making sure that I am giving people fair access and equity to nursing so they can go out and care for their communities. And that's it. Do you guys have any questions? Great. Well, if you do, I always have a open door policy, obviously if I'm not in a meeting. But I am always there. If you guys have questions, comments, concerns, you can always come to me, not only as a student, but if you have questions about, you know, in your workplace, if you've experienced it like Scholastica and the things she had to endure as a student. If you have questions like that, you can always feel free to come to me. I am going to tell you right now, in all honesty, I'm probably getting it. If it's things like that, I'm probably going to get angry, not at you, just at the situation, because I'm a very passionate individual and I don't think those things should be happening. But I'll use my anger to focus on getting, hopefully, the help you need. So anything else? You guys know where to find me. You're welcome.
Why don't you guys take 10 minutes and then we're gonna come back and do a little bit of practice interview questions and then we'll probably get out a little bit early. I'm sure you're so sad.